Welcome to Health Live at Seniors Today. We're here on a sunny April evening, and given the fact that it is sunny and it is summery, we thought it would be a good idea to look at a topic that is appropriate to deal with this week. We're talking about dealing with summer heat-related ailments for seniors, and we have invited Dr. Vipul Gupta, who's Chief Neurointerventional Surgery and Co-Chief of the Stroke Unit at Artemis Hospital in Gurugram. Before I invite him to speak and say hello to him, I'm going to introduce Dr. Vipul Gupta, and it's a rather long and very impressive CV. So I'm going to shorten it. As I mentioned, Dr. Gupta is Chief Neurointerventional Surgery and Co-Chief of the Stroke Unit at Artemis. He is trained in Interventional Neuroradiology from the All India Institute of Medical Sciences in New Delhi, where he also worked with as an associate professor till 2005. He completed his fellowship from the Foundation Rothschild at Paris and Cleveland Clinic in the US. Dr. Gupta has been visiting professor in UMass General Hospital in Boston. He specializes in intracranial aneurysms embolization, which is coiling, arteriovenous malformation, tumor embolization, in angioplasty, and stenting of arterial stenosis, including carotid stenting and intra-areal thrombosis for stroke. He has more than 45 publications in journals and 7 chapters in books to his credit. He's done more than 40 abstract presentations in India, in Indian and international conferences. He was awarded with the IMA Award in 2006, the IMA Academy of Medical Specialties Award in 2007. He's also featured in Hindustan Times list as one of the top 10 young surgeons in the country. Prior to joining Artemis, he was worked with as head of interventional neuroradiology at Max, and also as head of interventional radiology and neurointerventional surgery at Medanta, the Medicity, till May 2016. And as I mentioned earlier, that he has also worked with Ailments in New Delhi. So he has been at the forefront of medical sciences in the country. Welcome to Health Live at Seniors Today, Dr. Gupta. How have you been?
I am good, and thanks a lot for the very kind introduction. And
Dr.
it's
Gupta,
a pleasure to be here. And I look forward to interacting, and it need not be one-sided, of course. I mean, I will love to be an interactive session. Yes.
Absolutely. Dr. Gupta, I see you wearing of course, the medical jacket which doctors wear. But how hot is it really in your part of the country? I'm sitting here in Western India, and you are in Delhi. Is it really very hot, and is it unhealthily hot?
Okay, yeah, temperature has been rising very fast, and I think everybody read about global warming, and it seems scientists are very confused. The temperature have risen in last few months at a much more what they expected in spite of the global warming. Last March has been one of the hottest ever recorded on Earth, and Delhi and around temperatures touched 39 degrees centigrade, which is quite hot. I mean, 40 we say is absolutely hot. Although they are saying that maybe there will be some rains and temperature will drop, but clearly this year we expect a very bad heat wave. And of course, I am sitting in hospital and I'm in air conditioned very truthfully. So when I move out, I will know.
As I'm talking to you, as you are talking to us, I see that the temperature is 38 degrees centigrade in and around NCR of Delhi.
It's very hot at this point. It's evening time and 38 degrees centigrade, and we are still in April, by the way. May, June is when it's going to get bad. So, and that is where, I mean, as doctors, of course, everybody worries about diabetes and hypertension. We know that, smoking, drinking. But we are realizing now there are a lot of unusual risk factors for stroke and heart attack. Okay.
Yeah, so I'm going to interrupt. So, friends, the reason why we've decided to have this session is, of course, summer is related to heat strokes and various issues that concern people. What they call in Hindi loo, all right, which happens and you get dehydrated, but the dehydration also leads to a lot of other ailments, and we've invited a top doctor today, like Dr. Vipul Gupta, to educate us as to what we should be doing in the summer to stay smart in summer and to ensure that we don't get really hit by the heat wave. Over to you, doctor. So we'll, request you to listen in carefully to Dr. Gupta. He's not going to be making a presentation. He's going to be just speaking with us. Listen in carefully. As you know that this session is being recorded, and you can listen to it once again. You can watch it once again once it is up on our site on Monday evening. So you can do that. Listen in carefully, and after this, if you have any questions whatsoever, please raise it in the Q&A tab. Do mention your age and your gender, so Dr. Gupta will be able to give you a considered reply. And over to you, Dr. Gupta.
Yes. So when we talk about heat, so as I mentioned just a moment back, we know it causes more risk of heart attack and as well as stroke. In the data shows that 1 degree centigrade rise in temperature over next week increase the risk of heart attack or stroke by 2 to 3%, which is substantial. We're talking just 1 degree centigrade. And if there's a heat wave, they talk about 10% more chance of heart attack and stroke coming in. And, our country is hot and is going to get very exposed to this global warming. And these summers are supposed to be, we are going to get heat waves. So it becomes very important for us to know and what to do about it. So, of course, I think it will be very interesting. What's the relationship between heat and temperature and heart attack or stroke? Now, what happens is when the temperature rises, our body born to lose heat. So all of us know we'll perspire more. And even if we don't realize, we are losing water from our body through perspiration, even when we don't feel it. And this will happen. So we get dehydrated, so less fluid in our blood vessels. Also, the blood vessels in our skin, they will become bigger, what we call as medically dilated, so that more blood can go there, hot blood, and can lose heat. So when the blood flow gets diverted to skin, there can be less blood flow to our critical organs as well. And the blood will get thick. If you lost fluid and everything, the blood will become thicker, so clots can form. And they can go into heart or into brain to cause heart attack and brain stroke. Also, the heat itself can reach to some arrhythmia. That means the electrical system of the heart, and we can some irregular heartbeats, and as well as blood pressure changes. They all predispose to more heart attacks and stroke when the temperature rises. So, but then again, the question comes, okay, then who are most likely to get? Who should be very careful about it? So what the research has shown that people who are more than 65 years of age, and if they've got an underlying disease, for example, people have got kidney disease. When there's a kidney disease, if you lose fluid, kidneys need good hydration to keep working, particularly when they're damaged. Less fluid in the body can lead to further damage of the kidneys. So people who are old, people who have got underlying diseases, and people looking in hot climate like us. Interestingly, data also show that people who are living in lower income countries, they are more prone, which is again us. And of course, young babies, pregnant mothers, and people who are certain kind of medications also, which inhibit perspiration. They're meant not given to inhibit perspiration, they're for other purpose, but they have a side effect like that. People taking these kind of medications also, they are more prone to heart attack and strokes and have to be careful about it. Now, what to do about it is very simple. I think we all understand. Number one, avoid dehydration. Now, this may sound simple, but it is surprising how many of us, particularly when we grow older, we don't take as much as water as our body needs. So very important in summers, consciously, we should be drinking water all the while. And unless until you have got severe heart disease or kidney disease, your doctor has told you to be very careful about it. So we should be well hydrated. Number two, of course, if we are going out and it's very hot, we have to time our visits and the duration of visit very carefully and take some fluid with us. We should be wearing light clothes and light colored clothes so as the body can lose heat. And we should be very conscious about sign of dehydration. For example, if our mouth becomes very dry, we are feeling thirsty, you're not passing urine, or the urine you have passed is very thick and very deep yellowish, or you feel uneasy, slightly dizzy. These can all be signs of dehydration, and anything like that, you have to be very cautious, take a lot of fluids in our body, because if the fluid in the body will also maintain your temperature well, prevent these kind of side effects. So all these precautions we should be taking in the summers, and to not to have this unusual side effect of rising temperature on our health. Now, talking about it, you must have heard about heat stroke. And of course, as I was introduced, I'm co-chief of stroke unit at Artemis. So are they the same disease? No. When we talk about stroke as a disease, what it means is when the brain cells die because there is less blood flow to the brain. It can happen because blood vessels to the brain get blocked or the blood vessel burst to cause bleeding in the brain. So this is what stroke. Stroke is really same as heart attack. As heart attack happens when the blood vessel to the heart gets blocked, same way when the blood supply to the brain gets blocked for some of the reason, then we get stroke. While heat stroke is an extreme form of heat effect on the body. If somebody is exposed to extreme heat and doesn't take care, then the body's temperature starts rising. And when the body's temperature reaches 40 degrees centigrade, which is around 104 degrees Fahrenheit, this is where the blood flow to the many organs can get severely impaired and they can get damaged. These kind of patients can have neuro-like symptoms. They can be confused, disoriented, their temperature, but their body will be very hot, their heart rate will be very high, they will their breathing will be very shallow and very rapid breathing. It's a medical emergency. Heat stroke is a medical emergency, but it is not a stroke happening because of blood vessel through the brain have got blocked. It is because of the extreme heat, and it's called as heat stroke. And its treatment is separate. Patient should be moved to a cold area. If we can be given sips of water, they're awake enough, then we should give that, remove the excess clothing, keep some cold clothes over their body to reduce the body temperature, and ideally heat stroke patient should be taken hospital. While the stroke which we talk about, blood vessel gets blocked stroke, is very different. In these, the patient may have weakness of one side of body, you know, what we call as paralytic attack. If you remember FAST, FAST, F means face. If the face gets twisted, one side of face drops. A means arm. They're not able to lift one of their arm or the leg. S means speech. They're not able to speak or understand. These are the most common signs of stroke as a brain disease happening. And in this, the treatment is completely different because they should also be taken to hospital. But just like in heart attack nowadays, we try to open the blood vessels to the brain and we reverse stroke. That means a paralytic patient comes to us hospital in first few hours. Either we can give an injection into the vein to dissolve the brain clot to open the blood vessel, or same as cardiologists do, go through the leg blood vessel or the arm blood vessel, go into the brain and remove the blockage. This is what I do. We can remove the blockage and restore the brain blood flow and reverse stroke. Okay. So, so this is in concise that rising temperature is a risk factor, particularly for old people and in our kind of temperature, and particularly when they have underlying cardiac, renal, or a brain disease. We have to be very careful to maintain hydration, avoid excessive heat exposure, because this can also be a risk factor for heart attack and stroke. And of course, we have to be very careful about what is heat stroke is, and be very conscious that anybody, you or anybody else suffering those kind of symptoms, it can be a heat stroke, and it has to be handled accordingly as well, you know. Yeah. So, of course, why we are talking about in terms of heat stroke is because what we realized is all of us know about common risk factors for heart attack or stroke. You know, all of us know diabetes nowadays. Everybody has taught us diabetes, sugar checked, hypertension we knew, high cholesterol everybody knows. Being overweight is a risk factor we know. Smoking is a risk factor we know. We know eating bad habits, eating habits such as eating a lot of fats and oils and outside food and meats, we know is a risk factor. We also know nowadays alcohol is a risk factor. Just to tell you, all the topic is about heat and stroke. Even a small amount of drinking in Indian bodies is a risk factor for stroke. Our Indian body is different from Western. One glass of wine doesn't work for our bodies. We should actually avoid alcohol almost completely if possible. Lack of exercise is a risk factor. But these are the risk factors which everybody know. We talk about, we hear from cardiology, we hear from physician. But what we are recognizing nowadays, there are a lot of unusual modern risk factors which are coming. Excessive heat exposure, excessive cold exposure, and air pollution has become a modern risk factor of stroke. Lack of sleep time with the social media and screen coming in, that has become a risk factor for stroke. Excessive screen time, as I said, is a risk factor. And stress is again, these are all modern risk factors for heart attack and stroke. And all of us have to be conscious about these modern lifestyle related risk factors as well to prevent these diseases. And this has become important also because now we know stroke is the third most common cause of disease or death. In fact, World Health Organization has said that 1 in 4, that means if we are, let me see, 28 people listening, 7 of us will have a minor or a major stroke like thing attack in our lifetime. So 1 in 4 of us will have stroke, and so prevention is the best. And so when the temperature changes, again, we have to be very careful that our body may not adapt so well, and we have to take care of it to prevent such an attack. Yeah.
Thank you, Doctor. Thank you for your a fairly detailed account of what people need to be careful about. We have a few questions that have come in. I've got some questions on the SMS as well. We have fewer number of people who are live today on Zoom, but there are a lot of people who watch it on YouTube and Facebook later. We have a question from Mr. Prakash Jagtani. Sorry, how much water should one have to drink daily? Is it proportionate to what your body weight is?
I don't think doctors advise according to the body weight, and so usually what they say is that at least 10 glasses of water, or at least few liters, 2 to 3 liters of fluid should go in. Another important indicator is, are you passing urine regularly? Number one. And number two, what is the color of urine? It is very dark yellowish, deep yellowish, then you are probably dehydrated. It should be very light yellowish or straw colored urine and adequate amounts, then that is probably mean that you are well hydrated. Of course, this will also change depending upon how much hot heat you are exposed to. If you are being open air and all, then you need to drink a lot more water than somebody who's indoor, like we are in air condition. I'm not exposed to heat from morning to evening. But even then, I would say it's safely to say 2 to 3 liters one should try to drink, depending upon your body. But of course, it is very important if you've got a heart disease or heart failure, any disease like that, then drinking too much water can be a problem. So if somebody has like that, then they should be careful. But as I said, any signs of dry mouth, any signs of thirst, and as I said, less urine. Particularly, I have personally observed as a doctor, many old people, they're not conscious, they're not realizing that there's a lack of water in their body, and that makes a person slightly irritable, restless as well. But it's like chronic dehydration stage where they don't realize that they have to try to drink water regularly. Yeah.
Doctor, we have a question which has come in just now in response to this, which is that, Doctor, is it okay to have ORS like Electral on a regular basis, or is it better to have, I am slightly diabetic, so I'm asking you this question, or is it better to just have some Nimbu Pani and coconut water or chas or buttermilk?
So I think that's a very good question. So you have to realize electrol has been made for dehydration, which happens because of diarrhea or excessive vomiting, and you lost a lot of fluids acutely. So it's a very cheap mixture, but you have to also realize, since you're a diabetic, you've got dextrose in it. It's like sugar, okay? So I think electrol is only by and large to be used when you've got a diarrhea and something and you're very dehydrated, then it gives you everything and you drink it. But if you're diabetic, I would avoid it to be drink it regularly. No, one shouldn't do it. Just having a water and electrolytes coming in, like a little bit of salt along with some nimbu and all, it gives you electrolytes. So one can have that, because that avoids the sugar or dextrose which is there in electrol. So, have some water and have some, as I said, you can have, as we say, North Indian Nimbu Pani, little bit of it, but don't have a lot of sugar putting it into it, because that usually is not needed. And that's pretty harmful for our bodies on a longer run. Yeah.
And what about coconut water and buttermilk, as he
Yes, coconut water is very good. It has good electrolytes, but just be careful. Some people who have got kidney disease, then coconut water has a lot of potassium, and they should not be having but if you don't have anything, your doctor haven't said that you have to be careful about anything like that, then coconut water is also a good fluid medium to have. Yeah.
And chas and buttermilk as well.
Yeah, any kind of fluids you take. So it need not be water. Hydration doesn't mean only water.
Yeah, right.
So you can take in whichever way and mix everything together. Yes.
Right. Uh, Doctor, this is a fairly open-ended question, but I think
For sure.
it says, what are the lifestyle adjustments you would advise us to take during the summer for a senior citizen like me who is at the age of 66?
So again, if you like to go on walks, go in early morning, avoid sudden heat exposure. And I will say number one. Number two, as we discussed, if you're going out, it's not a bad idea to carry a bottle of water and having sips. If you're going to remain in open air or you're traveling for some time, Indian cities, you may spend an hour or two traveling. It's not a bad idea to have. I always carry a bottle of water. This is always in my car. Okay. And if I'm driving, I will have some sips of water. So having a lot of these kind of fluids is good, and avoid prolonged heat exposure. You may get dehydrated. Having cooler breaks is a better idea. So as I said, walks ideally taken early morning, late evening when the temperatures are down. Take a lot of fluids. If you're traveling or something or car, you're going long distance, have some water bottle with you so you can drink water, and avoid prolonged heat exposure. Sometimes one get enthusiastic, let's go on this trip, and avoid those kind of exposures if you can. Yeah.
Uh, Doctor, this is a question which is I'm 65. My late father and grandparents would say that it's good to have tea in the summer. What is your view?
I mean, you like tea, you can have tea, but tea doesn't carry that amount of fluids. So, and tea is warm. So I think you can have tea, but have a lot of other fluids as well. There's nothing like that. That tea works for summers. I think personally, I don't feel like having too much of hot tea when it's hot. At least Delhi is pretty hot, and I mean Gurgaon is pretty hot. So yes, you can have your tea, but that is not the treatment for dehydration, because it carries a cup have a small amount of fluid. You can't drink 2 liters of tea or something like that. That doesn't work for our body. So have a lot of water and other fluids as well, even if you're having tea. Yeah.
Right. Doctor, we have a question from Mr. Parthasati. He says,
Yeah.
during the night, he feels very thirsty. He gets up twice, which affects his sleep. He is 68 and having sugar marginally. Would you have any advice from him?
That's pretty unusual. I mean, I'm not a diabetologist, whether for some reason he's dehydrated. So, I mean, some people have this habit. I'm not the right, maybe he should discuss with diabetologist whether is any link to his diabetes or not. Or like, I have this habit, I will open my eyes, have a sip of water, and go back to sleep. So some people have this habit. I have it. I wake up at night and I always have water on my side and drink water and go back to sleep. You have to be also conscious. Do you have a habit of keeping your mouth open, breathing from your mouth? Because if you breathe from your mouth, that can be one reason why your throat and tongue gets very dry, and that is why you feel like having fluids. So you can ask your spouse or your family members whether when you're sleeping is your mouth open, number one. Number two, ask your diabetologist whether your sugar level, anything has got a link to it. And thirdly, as I said, sometimes some people have this tendency. I have the same thing. I don't have diabetes, another issue, but I'm very used to drinking water at night. Yeah.
Right. We have a question from Mr. Lakshmi Narayan. Dr. Sab, my wife, 65, has a very dry mouth as the salivary glands are not producing enough saliva. There doesn't seem to be any solution for this. What is your advice to him?
So first of all, I mean, usually it is just random that, okay, some people have a tendency for dry mouth, although there are certain diseases which can present with dry mouth. So I would advise you to still consult a doctor, ENT doctor, who can go through it. But if they've excluded is no disease, just like that you have a tendency for a dry mouth, then the only solution is have a bottle of water, keep taking a few sips from it to keep it, moist and comfortable. Yeah.
Right. We have a question, Doctor, from Katie Dadanchi.
Hmm.
Doctor, are paralytic strokes genetically passed on from parents to children?
Strokes.
That's right.
No, as I said, okay, as such, it's not genetic, okay, because as I said, strokes risk factors, we discussed hypertension, diabetes, and cholesterol, and exercise, and excessive weight, eating habits, drinking, smoking, and lifestyle, which I've discussed. But yes, So as such, it's not genetic. One should not think, oh my God, I've got stroke. But definitely some families have tendency for hypertension or diabetes, and we Indians are anyway very prone for it. So if you've got a family history of stroke, then I would say very early, maybe probably we should say after 40, I would say even mid-30s, one should get your risk factors checked and try to avoid all these other lifestyles which can lead to stroke, so that you decrease the possibility of having one. But as such, we don't say, oh no, it's genetic, father had it, the mother. But we have seen certain families, they have a tendency for cardiovascular disease. Like my mother's side family, all of them have diabetes, high tendency for diabetes. So that will come into me genetically. So I have to be very careful in my lifestyle to avoid. So I get patients where I tell their children, look, your father had it, but look, you're also overweight. His father had it in mid-50s, so might well make your lifestyle changes now so that to reduce the possibility of having it. You have to realize we Indians are very prone to cardiovascular disease. Data has come in recently. 1 in 3 we are pre-hypertensive. We are known as diabetes capital of the week world. We don't exercise much. So while we thought we are healthy and we eat vegetarian and all, no, sadly, we have a tendency to get cardiovascular disease a decade earlier as compared to Western or Caucasian, as we call as white people. And we are more prone to hypertension and diabetes. In spite of lower weight, we can have diabetes, which doesn't happen with Caucasian population. And there are various theories why our bodies are more prone. So overall, we Indian bodies are sadly more worse. So we have to be more vigilant with our exercise. Probably we need slightly more exercise than the whites. They say 30 minutes per day. Maybe we need 45 minutes of walk per day. So we have to realize we Indians are very prone to hypertension, diabetes, and therefore cardiac and stroke disorders. And all of us have to be very, very cautious about it. Yeah.
Right. We have a question from an anonymous attendee who asks, does radiation cause dry mouth? Does it block the glands?
Yes, radiation to this area. Because when the X-rays goes, of course, they try to focus on the relevant area, but it has got side effects and can definitely cause dry mouth in long term. But provided they've been given to that area where your glands got affected. So that is something which only your oncologist can tell you, which was the field of radiation.
Right. Doctor, there's just too many questions around water and taking of liquids, etc. But let me just address two of them, and then I'm not going to take it forward. One is from Mini Gogia, who asks, does coconut water change blood pressure, and what is the right time of consuming it?
So I don't think coconut water has too much of sodium to change the blood pressure, and so there is no particular time as I put in medically. There is a time to take coconut water. I mean, you can take it any time of the day, but as I told you, you got a lot of potassium. Some people with kidney disease, they have to be very cautious about taking coconut water. They should actually avoid it altogether. While potassium, we say as such is healthy, for kidney people, they tend to accumulate potassium in their body, so they have to be avoiding it. Yeah. It's better to not have one kind of drink. It's always better to mix, and water is the only healthy drink, by the way. All right. Yeah.
Right. There's a question from Mr. Vinay Srivastava. This is for a senior aged person. During the night, is it advisable to drink water after every time you go to the to pass urine?
No, you should not, because then you'll keep passing urine and keep waking up, which is and sleep. Having sound sleep is very important part of health. In fact, as such, many people feel that we should avoid drinking water even 1 hour before sleeping. Ideally, we should have our last meal 2 hours before sleeping so we can digest it. Water should ideally be taken up some time after the meal because it doesn't dilute. Otherwise, you take it just with the meal, it dilutes your enzymes after half an hour, 45 minutes. And then last 1 hour, one should avoid it. But at your age, use the older age group. Otherwise, you'll end up passing urine and waking up again, which is not good for health as well, to have a disturbed sleep. Yeah.
Doctor, we have a question from Mr. Kamlesh Vajpayee, who says he's 70, 50 kgs, BP around 140, takes Allmat 40, no sugar, walks daily, often feeling giddy while walking. MRI showed nothing unusual. Sodium is 130, takes normal salt. Is there something that you would like to advise him?
So this sounds like a patient asking for a medical advice, and I don't think this is the right forum. Without seeing you, without seeing the reports, I say, okay, it's fine or not fine. So my clear advice would be you have to show to a doctor if you feel giddy while walking, consult a good physician, and they will decide whether there's something wrong or not. I cannot be giving medical advices, when you have
Absolutely.
symptoms. Yeah.
And which is why I left this question for the last. And as always, to all of you over here, our sessions, our health life sessions, are advisory in nature. There's nothing like actually meeting doctors in person for a clinical examination and um, uh, for personal advice. Of course, you can also do teleconsults that are there. Doctor, this is a question which has come in: are there is there any link between an overexposure to sun and higher vitamin D levels and stroke risk?
All right. So vitamin D, of course, being exposed to sun is always good, you know. But if you are exposed to sun for too long, you become too warm and you get dehydrated, then of course it can. So I don't think you should be trying to expose yourself to the sun so that to the extent that you get uncomfortable just to get vitamin D. All right. So of course, so yes, exposure to sun is always healthy. Rising temperature doesn't mean you don't go to open air, but you have to be very careful not to have too much of exposure where you're getting dehydrated or your body is getting too warm. That is not advisable. Yeah. So, in anything in life, there's a balance, you know. Yes, exposure to sun is good, but too much and you get dehydrated, you get too hot, it can harm you as well. Particularly in this season, we are talking about next few months when the temperatures are high.
Right.
Yes.
Uh, Doctor, I'm smiling because it's a question I'm sure you have been asked several times. Doctor, I find the consumption of beer very refreshing in the summers. What is your advice?
I don't know. I take beer in afternoon. I feel like sleeping, so I always try to avoid it. So let me start from medical work. So there was a study done as Interstroke, which was about effect of alcohol on risk of stroke. Interestingly, while in Western population, mild drinking was healthy. That means it reduced cardiovascular risk factors. In Indian population, even small amount of drinking overall increases the risk. That doesn't mean everybody who drinks the risk. We're talking about overall possibility. So as I said, Indian bodies are different. As medically, absolutely theoretically, I will have to say, no, we should have to avoid alcohol. That logic of one drink per day overall. Maybe there are certain population groups, like there is a theory that in northern Western, like from Punjab and all, I mean, a lot of intermixing of blood from the invaders, and maybe they have genetically slightly different content. Maybe they can tolerate alcohol a bit better than rest of us Indians. So that apart. Okay. So in terms of strict recommendations, no, it's not that beer is healthy. Now, if you're 70, otherwise you're healthy, in between, sometimes you have a beer at a personal basis, I would say, all right. But again, one should have water with it as well. It can lead to dehydration, pass urine and all. That is not a replacement for hydration, by the way. Okay. I don't think we should take it like that. And as
Right.
I said, as a doctor, nowadays, we say no alcohol. Human body, I mean, Indian bodies don't work well with alcohol. Yeah.
So, Doctor, this I see. We're done with questions. I see an underlying message that comment that you've made about Indian bodies versus
Yes.
the international bodies and how what things work for us, what may work internationally may not necessarily work for us. And you are obviously aware of this big doctor, Dr. Google, who exists. And I'm sorry, I have a setting on change on my device where I got a alert. So Google obviously throws up a whole lot of information which is perhaps incorrect. Now, how do what kind of research should one look for? What kind of findings, research reports should one look for when you are trying to figure, what is good for your body and what isn't?
So the problem is what you're talking about, there's no simple way to answer it. I mean, there is so much over information, bad information being sold on internet. So I can't advise her how to research. Only thing which I can say, go to good health sites. For example, go to Mayo Clinic site. Mayo Clinic, Cleveland Clinic. They've got terrific website and which answer a lot of questions. Okay. National Institute of Health, which is like AIMS of US, National Institute of Health, their recommendations. Okay. So these, I personally am telling you, Mayo Clinic, Cleveland Clinic, which I mentioned, National Institute of Health, they've got very good health sites. And these kind of reputed sites want to look to. The problem is people listen to influencer and, in my joke on a personal basis in India, except for one own profession, everybody's expert for something else. We may not do well what we are supposed to do, but everything else, and particularly health, everybody knows. And okay, a lot of Indian old concepts are very healthy and very good, but you have to be very, very careful there. For example, everybody has heard of Baba Ramdev and he's famous for his yoga. Okay. And he says, okay, do this, good for hypertension, diabetes. Yeah, maybe I do yoga myself. It helps me. But that doesn't mean it can, once a disease has developed, it can cure it. Okay. So go to good reputed site like which I mentioned and follow that. A lot of people look for something which agrees from what they're looking for. You want to follow a path and you keep looking on internet till you find somebody who's saying what you want to hear. Okay, don't do that.
Okay. Absolutely, and thank you very much, Doctor, for clarifying some things. We've had sessions on stroke in the past, and I think you've made some very important points, and especially about dietary habits and water, etc. You have your session has been very enlightening. Thank you very much once again for your time. Thank you for the team which has facilitated this. And we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. You can pre-register for our Health Live sessions, which are the chat is the chat window has the link, and of course you can download our Evergreen Club app and attend all the sessions that we have. A host of sessions, 2 or 3 sessions every day that is there. Please take advantage of that. And of course, the next issue of Seniors Today magazine is going to be out next week, early next week. So you can take advantage of that and enjoy the content and enjoy the Seniors Today experience. And thank you very much, Dr. Vipul Gupta, for being here and for taking your valuable time this evening. Thank you.
It's a pleasure. It's a pleasure. I thoroughly enjoyed. And who knows, maybe in future we can have more interactions. All right.
Of course we must. Thank you. Thank you very much.
Thanks a lot. All right. Okay. Bye-bye.
Subscribe now and press the bell icon. Never miss an update.